research in 2007, even in 2009 in the northern part of the country. And it happened that I moved in many schools in the north. But I was quite disappointed because I found out that the girls are most affected in secondary schools and primary. Normally, the hygiene always are not the best in the north. Just maybe because of the wars in the north, I could not understand. But no waters in the school, so the girl child are dropping out of school because of water, and also the problem of sanitary pads. It's a very big problem. Their parents could not afford because they have been in the camps. The poverty is at the highest peak, so it's really a problem which is affecting, because you find in primary 5 in the north, primary 2, primary 3, primary 6, almost like around 20-30 girls. But when it reaches P7, you find only those who sit for the exams are only one student, female student, only one. So it's a very big problem affecting the girl child education in the north.
Looking at the university admission list for Uganda's oldest and largest university, one is struck by the ratio of boys to girls, which alarmingly tells a story many find difficult to attribute to the state of sanitation in our secondary schools. On average, schools in rural Uganda do not consider sanitation as a key factor. Many such institutions lack the basic facilities like access to clean water and toilets. Those that do not have structures are often left unattended, a situation that jeopardizes the health of the students that use these facilities. In the few rural schools that are lucky enough to have toilet facilities, the male and female students are expected to share the same facilities, which often offer very little in terms of privacy.
Sanitation, to me, is dignity. But unfortunately, most people do not want to talk about sanitation. They strongly believe that this is a private matter that we should not even be talking about. And this is the reason why you find that, everything begins at home. So if the homes do not have the latrines, then you find that this translates even to the rural schools. And this is where the challenge in this country actually is. And as a country, Uganda made a commitment to the Millennium Development Goals to ensure that we have at least above 70% of our population having access to sanitation. And that, of course, covers the latrine and hand washing facilities.
We actually need to put more emphasis. Maybe government needs to be informed such that they can be aware, because I think government do not have researchers at the moment who can move all over the country to find out what are the problems affecting the schools. So you find out that at the moment they are trying to close many schools because of hygiene. Actually, they should find out the cause of the problems before closing those schools.
I have told you today, schools begin, let me tell you, if a school begins with no capitation grant, there is no chalk, there is no money to buy even scholastic materials. Where do you expect them to get money to? Already the policy is, I don't want to find children beginning to clean the school at the first day of the term. That means now schools must have supporting staff. People are supposed to do the cleaning. A proper school should not have children cleaning toilets and slashing. There must be workers there. So because of that, there is no money to maintain that. How would you clean the compound when you don't have slashers, when you don't have hose? Yes, students can do some work, but their work is limited.
As you may be aware, Uganda loses close to 389 billion shillings in treating diseases related to poor sanitation. And of course, we could have saved this money and used it for other services, but this is not possible. We lose quite a number of our children, especially under 5, as a result of diarrheal diseases. A good number of people who are treated at the health facilities are treated because of poor sanitation and hygiene.
Instead of that money being pushed into the curing of the diseases, let us do the prevention. The necessary departments of government are not looking at the school. For example, health is not looking at schools. Health must move out into the schools to look at the health hazards which are there. The normal teacher may not understand some of the complicated health hazards. You get me? But if these organs, all of them had done their program and they zeroed down onto school, the situation we are describing today would not be taking place.
Media reports have quoted the government's failure to fulfill its international commitment to provide adequate funding to water and sanitation. This is translated in the consistent reduction in the total budgetary allocation in this sector every year that goes by. In a clearer perspective, going by the current statistical report, 2008 alone, a total of 122.8 billion was allocated for the sector. In 2009, 116 billion, in 2010, 127 billion, in 2011, 97 billion, and in 2012, it came down to 84 billion. This total translates to an average of 0.37% of Uganda's gross domestic product. The question therefore is, if this is what goes to the entire water and sanitation sector, how much do we see trickling to the schools?
The Ugandan government came up with a health sector strategic investment plan, under which they provide for a national minimum health care package that they are supposed to deliver to Ugandans. But you find that one of the core issues under the minimum health care package is a focus on prevention of diseases. And one of the biggest ways that prevention is achieved is through having proper sanitation, both in the schools and also in the homes. And where you see that there is lots of diseases that are resulting from poor sanitation, that means the health budget is also going to go up.
A number of schools were visited in the year 2012-2013 to ascertain the situation of hygiene and sanitation in various schools. Though the situation in other parts of the country record worse scenarios, the picture we see is representative of the country's plight in the field of sanitation. We trailed the Mukono Municipal Council Schools Inspector, Miss Olivia Nabulia, as she went about her work in a number of schools in Mukono, and were alarmed to find that most schools do not adhere to even the bare minimum standards of sanitation as required by law.
But really, when you talk of sanitation in schools is bad in most schools. You look at the latrine stances and the ratio of the latrine to the pupils is very small. When you look at the girls, oh, that is so bad. Because most of the schools don't have shower rooms. Girls, if they go in their monthly days, they cannot help themselves. When we have day schools, which don't have boarding facilities, these day schools cannot provide shower rooms. The girls don't have equipment to help themselves. When you look at even the schools themselves, they don't have enough water. They don't have water sources. And you find out that girls have to go home to help themselves.
The Department of Public Health has collapsed completely. Health inspectors, where are they? They don't go to schools, they don't go to markets. Maybe if they go to markets, they get a few kilograms of meat from the people. I think that we need to resuscitate these government organs now. Otherwise, we are killing the citizens of Uganda.
Officials within the Ministry of Education and within the Ministry of Health should be able to work together to ensure that there is a rolling supervision that is going on in schools to ensure that they capture the poor sanitation, the trend for poor sanitation before the situation actually becomes critical.
The state of these washrooms does not foster good health amongst the student, as often girls pick up urinary tract infections like candida. These ailments are often left untreated, thus making them severe, and later warrant their absence for longer periods from school.
When you look at some of these learners, they get infected with candida, and they can't even learn. We want to look at the effects of candida, of environment and sanitation, hygiene, in schools and how it is affecting learning and teaching. Because there is no way, if a teacher went into that toilet, if he acquired such a disease, can go to class and teach. If a learner has acquired such a disease, can come to class and learn. So it is a big effect whereby even the maggots are moving over the walls. Can you imagine? Learners can't get into that latrine. So that means that down there and inside the latrine is dirty.
Did you ever suffered from candida?
Candida is pinching here down. Even can't stay in class when the teacher is teaching because of the pinching.
I was there in the dormitory and the things they started doing what? Pinching me. After I went to the matron, other students they told us that is candida. We stop urinating in the bathrooms, we go to the toilets.
Candida is a fungal infection and it's commonly caused by a fungus called Candida albicans. Everyone has it, but for you to have an infection, the condition just becomes favorable for that fungus to overmultiply. And when it overmultiplies much more than the usual number of organisms in those areas, then you get the symptoms of infection. It depends on the severity. If it's very severe, it can be very uncomfortable. Like it could be itchy, painful, you could have, if it's complicated, you can miss class and you can even be admitted.
What is worse is that most of these students from rural families have no access to treatment of such ailments, as health centers are usually far, few, and understaffed.
When you get like recurring attack, you may get, it can spread from being a local infection and then it goes systemic. It can ascend and affect the other internal organisms.
According to an international non-governmental organization, WaterAid, out of the 33.4 million people in Uganda, 9.3 million people, which makes up for a quarter of the country's population, do not have access to safe water, while around 26,000 children die every year from diarrhea caused by unsafe water and poor sanitation.
The school is operating illegally, no source of water. So we have been tracing for the source of water. But actually, when you trace for the source of water, even that is the way the learners trace for the source of water. The school should be enclosed and water should be within the school premises. But when you look at this school, they don't have anything like any source of water around the school.
This is an issue that is now affecting very many schools at both primary and secondary level. It is disproportionately affecting the girl child, and it is high time that the government of Uganda, through both the Ministries of Education and Health, and to an extent the Ministry of Gender, Labour and Social Development, they come together, work together, and ensure that there is adequate sanitation in schools to enable both the rights to education and the right to health.
For teenage girls in rural schools, the onset of the menstrual cycle brings with it new challenges. Not only don't the schools provide sanitary wear like pads, but also students are often taunted by colleagues in case of menstrual accidents, which teasing discourages them from returning to school. Some even go as far as dropping out of school, which places them in danger of early marriages.
If the boys saw some girl when having her bread, they starting laughing. They start rumor among us that, hey, you see that boy, you see that girl, how it looks like. Then the boy starting, then there is some girls have bad manners. They don't tell you that you have bread in your bam bam.
So what we do, we get water from the spring well to help our girls, especially when they are in their periods.
we help them. We take them to the shower, even if although it has no shutters, we take them to the shower and then they clean themselves.
What we found in some of the schools is that almost all of them that we visited that had poor sanitation, you find that when there's poor sanitation, for example, the toilets are not good, the toilets do not have doors, you find that it is the girl children who are more affected and they will end up not going to school. In situations where students do not have sanitary pads to assist them during their monthly periods, you find that many of them will remain home for fear of being laughed at by their colleagues in school. So you see that it's in a way, you know, Uganda kind of is working towards achieving the Millennium Development Goals, but these are some of the things that take us back, you know, in terms of achieving things like gender equality. How do you achieve gender equality when the education of the girl child is being affected?
Right now, we call upon the ministry to help in the schools and mostly in the girl child, because this one should be budgeted for the Ministry of Education and Sports, because you find out that the dropout rate of girls from schools is high more than the boys.
Our government is very good in terms of coming up with policies. You find that the Ministry of Health has comprehensive policies that cover issues of sanitation, and the Ministry of Education will also talk about sanitation in schools. They will put in place inspector of schools, but these offices are not adequately facilitated. So we must move from policy to implementation of policy. That is what we implore the government of Uganda to do, and this can only be done through adequate allocation of resources to these offices that are meant to monitor some of these things.
So we are allowing that because people's minds are not focused. Let us focus. A school is supposed to produce a healthy citizen, physically, mentally, and emotionally.